I'm thrilled to see so many of you logging in here today. So my name is Roberto Sassa. I'm a child adolescent psychiatrist. I'm the chief of psychiatry at the BC Children's Hospital and BC Women's Hospital, and also head of the Division of Child Psychiatry at the UBC. Calling here today to all of you with gratitude from the unceded ancestral traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And I hope you take a minute this morning as well to reflect on knowledge with the gratitude, the history of the peoples whose lands you may be calling from. I'm very thankful to all the sponsors that helped us support our conference today. That includes our department at BC Children's Hospital. We also have support from the UBC Department of Psychiatry, the UBC Institute of Mental Health, the McGill Department of Psychiatry, Foundry BC, Coast Mental Health, and all of you as attendees can learn more about our sponsors on the Let's Talk Overdose event website. And you're also going to hear from experts representing those organizations throughout the conference. As you know, this is our 4th annual Let's Talk Overdose conference, and we have over 1,200 people registered for the conference this year, which is a fantastic number. We have more than 60 speakers, 10 Canadian provinces and territories are represented here, 10 countries are represented in the conference today, and I'm really thrilled to see how many people are joining us for a conference today. So that clearly shows that when we talk about overdose openly, we're talking about a problem that extends way beyond our borders here in BC and our borders here in Canada. You see that we have a fantastic lineup of speakers and presenters throughout the day today, and hopefully we can all brainstorm together ways to address this problem, which is the #1 cause of mortality in BC for the ages 10 to 59, as most of you might know. And it's my pleasure to start the day by introducing Dr. Lakshmi Yathan. So Dr. Yathan is a professor and head of the Department of Psychiatry and director of the Institute of Mental Health at the University of British Columbia here in Vancouver, Canada. He has an executive MBA in healthcare from the Sauder School of Business, and his major areas of research include neurobiology and treatment of bipolar disorder and major depression. Dr. Yathan.
Thanks very much, Roberto, for that kind introduction, and good morning to all of you. I'm joining this meeting from traditional unceded territories of Musqueam, Squamish, and Tsleil-Waututh First Nations people, and like many of you, I'm grateful for the opportunity to work and live on these lands. Now, let me take a minute to extend a warm welcome to all of you to this UBC Department of Psychiatry sponsored conference on Let's Talk Overdose. As most of you know, since BC declared health care emergency in 2016, more than 14,000 people have died because of overdose. And last year alone, over 2,500 people have died. So if we really look at the trends, they're not even stabilizing, let alone a trend of going down. They're, in fact, the numbers are going up. And this is, of course, not because of a lack of effort, because as we all know, in BC, the provincial governments, health authorities, philanthropists, and many experts have put in a lot of time, effort, and resources to address this huge healthcare crisis. And yet, all these efforts have really not had any significant impact. So clearly, I think we do need to find innovative solutions. And within this context, a conference like this, organized by my colleague, Dr. Michael Krause and his team, is very timely because What it does is it brings researchers, clinician scientists, frontline clinicians, policymakers, people with lived experience and their families and other stakeholders together to exchange ideas and to try and work together to try and see if we can find innovative solutions. And what the conference also does, I think, is to communicate some of the cutting-edge advances to frontline clinicians as well, because there are some tools that are effective in addressing this challenge. Opioid agonist therapy is of course, one of them. So really, we do need to work together to not only communicate some of the advances in research, but also start thinking about finding other innovative solutions. And I'll say that UBC Department of Psychiatry is very much committed to addressing this challenge. And within the last couple of years, we created a new division within the department called Concurrent Disorders Division. And we're really trying to build a critical mass of people that include researchers, clinician scientists, and clinicians with expertise, and how this group work with frontline stakeholders to address these challenges. I do want to thank you all for attending this Congress and doing your part. And I do hope that you will have a very enjoyable day, because as Roberta pointed out, the committee has put together an outstanding scientific program with opportunities for that exchange of ideas and collaboration. So thank you very much. And I do hope that you have a very enjoyable day.
Thanks so much, Lakshmi. My pleasure now to introduce Dr. Jenna Davidson to all of you. She is the Chief Medical Officer at the BC Children's Hospital and BC Women's Hospital and Health Center. Jenna is a child adolescent psychiatrist and a clinical professor as well in the Department of Psychiatry at the University of British Columbia. Jenna, the floor is yours.
Thank you so much, Roberto. It's a pleasure to be here. I'd like to acknowledge that this morning I have the great privilege of calling in from the traditional ancestral territory of the Tsawwassen First Nation, the land by the sea, which is a beautiful area in the Lower Mainland of British Columbia. And welcome to this 4th annual Let's Overdose Talk conference. Let's Talk Overdose conference, rather. It's amazing the number of people that have registered from around the world, and what a phenomenal group of speakers that have been pulled together today to share thoughts and ideas and research with respect to overdose. And I know that there are 8 workshops specifically focused on providing mental health, substance use, and tertiary care for youth, adolescents, and young adults, which is an area that's near and dear to my heart as a child and adolescent psychiatrist. And I can't emphasize the importance of the care research and hearing the voices of those with lived experience as we move forward, and to do so in a good way. As Lakshmi mentioned, we continue to struggle with death by toxic drug supply in British Columbia as a public health emergency. He mentioned the statistics, which are shocking, but I think the one that hits me the hardest is the deaths per day, which through 2023 were approximately 6 per day. And as he mentioned, the crisis is not stabilizing, because through November and December, that increased to about 7 deaths per day through toxic drug supply, leaving us with unregulated drug toxicity as the leading cause of death in BC for those between 10 and 59. And although that information is horrific, there is some room for hope, and it's interesting in the statistics. The leading cause of death among 15 to 18-year-olds in BC shifted to toxic drug supply through 2023. But overall, there were declines in the rates of death in those between 19 and 29 and those under 19 years of age. So I'm not sure what that suggests to us, but perhaps gives us a small window of hope that in some populations, there is some benefit to the work that's being undertaken. Those that are in BC know that we're navigating a changing policy landscape, and that requires, I believe, a focused commitment by all of us who work in this space at any level toward trauma-informed and compassionate care for those whose lives are impacted by substance use and dependence. And as we move forward in truth and reconciliation in British Columbia, that is extremely important as we move forward in our work. I want to thank you for the work that you do every day. If you're joining as someone with lived experience, thank you for your courage in sharing your experiences and helping inform the system so that we can improve for those that provide care and undertake research. Thank you for expanding our knowledge and ensuring that the best care available for those that are experiencing substance dependence is the best evidence-based and wise practice that we can provide. In closing, I will share with you 6 teachings gifted to the PHSA by Coast Salish knowledge keeper Shane Point Selkson. These teachings help guide the work I do every day, and I hope they will help guide you today. Eat is the first. Truth. You need to say the truth all the time. How you act and show up must be truthful. We need to be truthful in our work, and we need our truth to be heard and not denied. We all must not deny the truth of the history, and we must remain committed to addressing it. And Islakson, good medicine. Medicine is all things, the geography, the ecosystem, the water, and all other living beings. As human beings, we can choose with intent to be good medicine every day. Nutsamat, we are one. Everyone and everything are of value and has purpose. All living things are connected and are inherently entitled to dignity and respect. We all need to be thankful for and take care of all things, including the water, the plants, and the land we occupy. When we know ourselves to be one, we are grateful for Mother Earth, ecosystems, the water, and all human beings. I will leave you with the 4th teaching, Walks hooks in Schwallowen. Open your hearts and your minds. Open your hearts and minds to what is being taught to you. When you are open, you are able to do your best. I hope that you can take these teachings with you and think about them as you're proceeding through this amazing day of learning, so that collectively, wherever you are from, you're able to contribute to making a difference. Thank you.
Thanks so much, Jenna, for grounding us in the work that we do and remind us that change is possible and bring us hope for the work that we do. And it's my pleasure now to introduce you to Dr. Alexander Calderella, who is a bilingual family physician with a specialty training in substance use health issues. He joined the Canadian Centre on Substance Abuse and Addiction, CCSA, as its CEO in August of 2022. And as a leader and a clinician, he brings years of collaborative substance use healthcare experience to CCSA from his work across the country. Dr. Calderella.
Thank you so much for the invitation today, and it gives me such a pleasure to be part of the group that gets to welcome you to this amazing day. I really do hope that there's an opportunities to share and learn. And looking at the program, I'm incredibly impressed at the breadth of topics and areas and issues that will be covered today. I think it really is a powerful reminder that we need complex solutions to these very complex problems. For those of you who haven't had a chance to work with the Canadian Centre on Substance Use and Addictions, or CCSA, before, we've been around now for 35 years, intended as a neutral arm's length agency that provides leadership on substance use health and to advance evidence-based solutions. And we work a lot with the federal government as well as provincial governments and people across the country. I really did spend my first year trying to understand and to listen to diverse voices on how we need to act and how we can achieve the most impact as an organization, but also as individuals. And for me, a number of things have really come down to three big principles. Hope. I think that we need to acknowledge that this has gone up and down, and during periods of it being down, it can produce some pretty terrible outcomes. The question of access and access to care, because innovation is critical, but ultimately we do face a situation where most people don't have meaningful access to supports and services. And the last is one of collaboration. I think we've talked a lot about solutions, and we need to be spending a lot more time talking about how we can work together to achieve those solutions. I think back sometimes to very early in my training, actually, and the idea that I was working one night or in the emergency department. There was someone who was having significant behavioral disturbance in the emergency department. In retrospect, I realized that there was somebody who was in withdrawal who wasn't being treated for that. I remember the senior doc at the time turning to me and whispering that he really wishes that he could give all those people a lethal injection. So it took me a while to realize that what people say like that in whispers, they express loudly in their actions, especially on the way that they treat people who use drugs and substances more broadly. I think that that stigma that we see has a lot of different roots, but a lot of it and a lot of these painful knee-jerk reactions people may have comes from a lack of hope, a lack of a belief that substance use disorders are treatable, that people's lives can get better, that health is achievable. And I hope most people in the field appreciate that, but I think there's a recognition and a need for us to be able to support the broader audience and the broader communities in understanding that. Because the reality is that the people who lived and living experience, and as was mentioned, I'm so thrilled, and I hope many of those in attendance are from that community. They wear this every day, and not just them. I mean, every mother who's lost a child to overdose has to wear a feeling that people don't care or feel that their child's life didn't have value. That's why it's really important for us to join our voices, and we have to take days like this to really not only move things forward, but to remind people that they matter and that their health and wellness matters. You know, every time someone doesn't get the care they need in hospital because they weren't treated well, because they were discriminated against, because they were better off leaving the hospital than not, it's really a failure not of that individual, but of their health systems. We also have to recognize that every time someone has an overdose, their friends are too afraid to call 911. That's also a failure. We have to realize that when people want help so desperately, but can't get it, that's a failure. And when we talk about these issues of access, I mean, I think across the country, what I hear over and over again is if you go to the emergency department, you are, especially with an opioid issue, and even after an overdose, you are more likely than not to not be offered support care. In a recent survey that CCSA had done with the Lived and Living Experience partner organization, CAPSA, I found that less than 1% of people were comfortable going to their family doctor for help with drug or alcohol issues. In Ontario, there was a recent study that showed that OAT rates amongst young people over the past 10 years has actually been reducing and not increasing, lead to the issues of provider comfort, stigma, and different pieces. We're at a time when we haven't done enough to grow those doors of access, and people at the same time seem to be hurtling themselves against doors that aren't open. It's one of the main reasons that CCSA has spent a lot of time and will be soon releasing competencies for all prescribers. This is the idea that every single person has something to lift up and a role to play. And so throughout the day, I'd really encourage you not only to think about what you can do, but what can you get your colleagues to do, especially those that don't have a special interest in substance use, health, and addictions. How can we raise everyone so that we can make this a little bit more of everyone's issue? Because we have to recognize that no Canadian jurisdiction has resolved these challenges. There have been significant collaborative challenges, and a lot of these come from pain and trauma. We want things to be solved quickly. We want to move fast. We feel an urgency, but at the same time, that has sent us off in all these different directions. We have to think that if we were trying to build a rocket to the moon and we were all trying to build our own rockets, we'd probably never get to the moon. It would look fancy. We'd probably have quite an impressive fireworks show, but we wouldn't actually get anywhere. And I think that's kind of where we're at right now. And I think when we look at places that have tackled these kinds of things successfully, they've done so by not only recognizing the humility. That's why I think it's so important to have heard from a number of the introducers so far that the death toll, the suffering is not acceptable and it cannot become the new normal. So we need that humility. But I think also it's been able to raise people, not within silos, but across a whole of health, whole of government, and whole of community approaches. It's really about recognizing that we need a spectrum of care, a whole thing that includes treatment and harm reduction that arcs always towards improved health. We also need to recognize that there's an important role for prevention. We don't talk about it as much in the context of overdose, but we have to remember that the first emergency declaration on opioids and overdose was 8 years ago. And prevention, it's true, is not going to be the solution for the people who are currently at the greatest risk of dying. But when we look 8 years ago, when we look at who prevention can work for, that age group, we now recognize that those 12, 13-year-olds, they're now 20, 21. They're the ones dying. They're the ones having the burden of this. Every community deserves to feel safe, and every person deserves access to the care they need, where and when they need it. I want to end by saying that people want to help each other, and we need to create more opportunities for them to do so. We've been working with people who lived in living experience, families, physicians, and communities, and police to move this forward. The real solutions will come from these communities. We're hosting a series of community level summits, and we really hope that people will increasingly become involved and participate in this, because we really want these to be oriented on the ground where issues are most felt. I can sit here and tell you that substance use issues cost $49 billion per year. But at the end of the day, it's really about people and individuals and about moving that collaboration, moving that hope, moving that access forward. It gives me a great joy to be able to introduce this today further. And I just so excited to see hundreds of people here really with a desire to move things forward I can't wait to hear from so many of the sessions today about what kinds of solutions people can come up with. I really hope that increasingly people can look to CCSA as a potential partner, as a way to amplify things that are happening in BC outside, but also as a way to learn the lessons learned from across the country and bring them home to your jurisdictions so that people everywhere in cities and towns can lift those evidence-based solutions up and finally turn the tide on something that has been very, very difficult. Thank you very much, Roberto and Michael.
Thanks so much, Dr. Calderel, and thanks again for reminding us that the unfortunate power of stigma and preventing people from getting the right care, and how only with collaboration across different sectors, including people lived and living experience, we can move this forward. And